Trócaire opened up an office in Malawi in 2007. Since then, Trócaire has been supporting projects with a strong emphasis on advocacy. The meaning and impact of advocacy work is not always easy to show. Trócaire in Malawi understands advocacy as a type of support that is provided to make sure that the basic rights of the most marginalised and excluded Malawians are heard, respected and fulfilled by those holding power. This work is delivered in collaboration with local organisations, Trócaire's partners on the ground. This documentary is about breaking down what advocacy means. It is about showing the great results that Trócaire and 3 partners are achieving in Malawi through supporting good advocacy work. It is also about showing the need to bring that support to the local level, about the need to work closer to people.
Trócaire's been in Malawi since 2007 when we opened an office, and we've been working with local partner organizations, notably the Malawi Health Network, the Malawi Economic Justice Network and the Education Coalition. What they've been doing is at a national level looking at budget monitoring and how that can be improved in order to get access to services for poor people. However, we felt that there was lack of that sort of link with the community level, with the local level, so that we proposed to those partners to do much more at that local level with communities to make them aware of what rights they have and how they can access better health services, better education and other government services.
The coalition works towards improved education system in Malawi. We note that as a country we are faced with various problems which range from inequalities, inadequate number of classrooms, inadequate number of teachers. Some of the schools, because they do not have adequate classrooms, do actually teach some pupils outside the classrooms. And all these problems have a huge implication on the quality of education system in Malawi. By working closer to the communities, it has actually empowered the communities to bring issues to government in order to influence policies that have a bearing on the provision of quality education in Malawi.
The staff and students from this school in Mchinji, central Malawi, did not for a long time have access to any source of water. This resulted in long hours of teaching and learning without being able to drink, lack of proper hygiene measures in the school, and dropouts in the dry season due to exhaustion and dehydration. The Education Coalition helped the school community to get organised and demand some support from key actors at the local level to help solve this problem. As a result, villagers got in touch with a small local NGO who finally provided the school with a well.
Amwe watu nosindika chifukwa maji tikutunga pafupi ana ausamba mmamawa pika chakudya mofulumira ndi ana kusukula kupita mwamsanga. Tusanga afwa bebe matenda ena yaliose ngati otsegula mimba kulibe tokhala bwinobwino.
In this area of Mzuzu in northern Malawi, kiosks close to schools used to sell liquor to children as an easy way to make profit. This resulted in kids not able to attend classes, high levels of dropouts and fights amongst students. Through the work of the Education Coalition, the City Assembly, Department of Environmental Health and the police reinforced that alcohol should be sold exclusively in designated licensed places only. These local kiosks are not allowed to sell liquor anymore.
When we learned about this problem and knowing that it was affecting quality of education and it was also affecting just access of education by these small children, we felt that something had to be done. And what we did was, through the funding that we obtained from Trócaire, we mobilized the people around Mzuzu, working through the District Education Network to come up with laws that would prohibit any other sellers from stocking cheap sacheted liquor in the shops.
anasukula kumabwera kuzagula ngati mwina kugula bread Mchinji twinato autenga kugulako tumowa ni timene daona anambira chita choncho anambira akalezera kumasukulu samapita amathawira chifukwa chake naganiza kuti ndisiye kuphunzitsa.
Mehen aims at improving health systems in Malawi. As a country, we face a lot of challenges in the health sector. For example, serious shortages of healthcare workers, whereby you have other health facilities having one clinic officer and one nurse working 24 hours, which in the end compromises quality of services, but also problems to do with the inadequate health facilities, and communities have to walk some 20 or 30 kilometers to access health services from the nearest health facility, in addition to shortages of medicines and other medical supplies. It means a lot for Mehen to be closer to the people, because we are in direct touch with the people that we are representing at the national level. Malawi, historically, you are looking at a communities that are normally very silent. So it has helped us to empower the communities to begin to speak out and demand their right to health from the healthcare workers.
This health centre in Dowa in central Malawi was closed due to the lack of staff, proper equipment and medicines. People living in the surrounding villages had to find alternative solutions to access health services, which sometimes resulted in long walking distances to the nearest health centre, or weak patients simply just giving up on any sort of checkup or treatment. Mehen helped the community to mobilise and demand that the health centre be reopened.
Mehen received some funding from Trócaire. The funds were used to give to its network members, Mehen's network members, to train the people of this community on their rights and responsibilities. So this health center was closed due to inadequate health workers, and because the people are aware of their rights and responsibilities, they requested for the health center to be reopened.
Ana amaenera kubadula kumudzi chifukwa chosoweka mayendedwe opitira kutali kuchipatala abadula pompano chithandizo cha matenda akulu ngati amalungo ako okomoka chimapezeka pompano situmayenda mtunda wautali kupita kuchipatala kumponera.
The people from this community in Malomo in central Malawi have no easy access to a health facility. For a long time, villagers were asking local authorities to provide the neighbourhood communities with an ambulance that could transport the sick people to the closest health centre. Through the work of the Malawi Health Network, the local authorities finally provided the ambulance, which is now serving more than 40,000 people in the area.
Pano pati kuthandizika mofulumira monga ngati neyo Grace Kampota ndikupereka chitsanzo kumbali ya ineyo ndinadwala serious kwambiri matenda anga pamene ndimanyamuka anthu amangu kuti mwina amene kujatani amwalira koma nditadzafika kuno kuchipatala atandiona adokotalawa anandithandiza ananena kuti kuma matenda andiofunika kuti kuchipatala kunchisi anayitana driver nditengera pa ambulance kupita kuti kuchipatala panopa ndikuthandizika chifukwa cha ambulance pafupi idakakhala kuti inali kutali mwina nthawi imene ndidakataso chani moyo wanga.
Imagine primarily we would want Malawians in towns, in the villages, to know about the national budget, to know how government does its business of bringing the development to the people. We believe Malawians are the bosses. They elect the particular government so that they can help manage their affairs and serve them better. So our work revolves around this. The advantages of our work, with the people, with the Malawians, they are able to see this as their own. They see the national budget as their own, and they understand that they have to be part and parcel of the process of putting together the budget. So this is the biggest. The second point is
they also know that whatever they want, they can make it happen through the budget by being part of that, but again by following up and seeing is the money that was allocated for a particular project being used for the intended purpose.
The high school in Mchinji, like many others, suffers from overcrowding, so eventually the school board succeeded in diverting funds into the building of a new classroom. As money is tight, the head teacher is keen that every last penny is accounted for, but the government-funded construction company refused to provide a breakdown of cost. With the help of Mchinji, they are on their way to pursuing transparency in this project.
After seeing the delivery notes, we saw that there were no costs. They could give us these items, but without the indicators of how much they were bought. So we were afraid. Why can't they review to us? Why can't they be transparent to us? The Mchinji people helped us to make a follow-up. Then I, as well as the village head woman, we went there to the DC asking for the costs, transparency of the costs of the items which we were receiving.
Malawians are entitled to know what the national and local budgets are, what the process is to place their demands in them, and how to monitor that what is included in these budgets is actually happening. The local authorities in Ntcheu, following training and advice from Mchinji, decided to do something unusual. For the first time, the local budget was displayed on the wall of the district council building, allowing every villager to come and have a look at services and expenditures that had been approved. This is a great step forward towards increasing levels of transparency.
So this board is meant to provide an open window for people to come and question the use of public resources after studying the information provided. This means we have achieved transparency, accountability, but also governance, good governance. This is what we may call good economic governance.
That's the total budget.
Trócaire believes that positive life changes resulting from advocacy processes do not happen overnight. This is due to many cultural, educational and historical factors. Trócaire is committed to continuing to support Malawian partners on their advocacy efforts towards building a just world. For this work to continue, the organisation needs to count on the invaluable support of donors, Malawian citizens and of course the Irish community.
It's impossible to have the processes changed overnight because here is a community that for decades has been very quiet, silent, they don't believe in speaking out. So it requires a lot of time, step by step, and then empowering them so that they can begin to speak out.
One step, every word I say. One step, coming on Dowa. One step, shining for revolution. Whoa, yo, yo, yo. One step, get ready. One step, del sol dale. One step, hoy somos uno bajo un mismo sol. One step, pa frente, vamos. Oh, yo, yo, yo. One step, get ready. One step.